Welcome back to Good News Covenant County. Folks, we're really, really lucky to have somebody coming into our medical community. He's sitting over here to my right. His name's Dr. Robert Long. He's, I can tell you that he's a good doctor because about 12, 14 years ago, he did some work on me. I had some really bad problems with kidney stones. We had to do, and ultimately, I think we had to do 3 lip strips just to kind of get it broken down. But he was good. I got great care out of him. He saw my problem. He was genuinely attentive to what my concerns were and needs were when I'd visit with him. He wanted to know everything. I appreciate that so much. There's some other stories I can tell you to recommend him, but I'm not going to. I'd like to read you his credentials first. Now, he's originally from Louisville, Kentucky.
That's correct.
And he went to medical school at the University of Kentucky, which is a great school. He did his general surgery, and I guess that would be your residency as well.
First 2 years of the urology training for me was general surgery training.
So that was at the University of Louisville Medical School, correct?
1 year there and 1 year at Medical University of South Carolina.
Okay, South Carolina. That's, see the notes in here. Yeah. And then he did his residency in urology at the University of Louisville. And he did a fellowship. And then he used to go out and get a fellowship with some fellows. He went out and got a fellowship at a really a place I would highly recommend. He had a fellowship at Mayo Clinic. You want to drop a name or two? Mayo Clinic, that's pretty good stuff. And that was in
Neurourology.
Neurology. And he has a special interest in benign prostate disease with blockage. Now, I've never had to use anybody for that, but I've had friends that have been in some very, very painful positions because of that. I mean, painful. You help a lot of people. And benign prostate hyperplasma, is that right?
Hyperplasia.
Hyperplasia, that would be moved somehow or other.
Hyperplasia just means enlargement.
Enlargement, okay. Anyway, so this is Dr. Robert Long, Dr. Robert L. Long, a man I can recommend, a man that's a doctor with a heart. Let me tell you, there's plenty of doctors with hearts. There are not very many of them that's good at doctors as this one right
Thank you so much.
Well, you know, it's not, I've been talking about you ever since I heard you were coming to the hospital. I've told people out there at the hospital, the lady that's in charge of the surgical room, what a great guy you are. I mean, just
I certainly appreciate it.
I mean, I'm sure they know all that, or they wouldn't have tried to make arrangements to get you on staff up here. But you know, I'm so glad to see him here. I mean, this is just typical of what John Yang and Andalusia Health's been doing for the last couple of years, trying to bring in really well qualified people that can provide services to us here in Covenant County that are on par with Pensacola or Birmingham or Dothan. I mean, that's what a feather in our hat as a community to have you here. Thank you for coming.
John has done a wonderful job at the hospital, and I've been so impressed by all the people that he works with. I actually met many of the administrative people and some of the nursing staff over the course of time, and he's worked hard. They're working on their stroke program and their heart program.
Yeah, Greg Price is real instrumental in that.
Yeah, it's a level 3 trauma center.
Yeah. We've had we've had a lot of the doctors on here as they've come in and continue to have it on here. And then I think last week we had Dr. Patrick Kelly on here, the ortho guy that's moved here. Moved here last November, and he's a friend of the show. But we're so glad to have you.
Well, thank you.
You know, to show you what a good doctor he is. He knows that we're not doctors, and we didn't sleep in the Holiday Inn last night either. But he's very interested in providing information to the community that will help him. And he actually brought us some things that we needed to be aware of, a little syllabus or cheat sheet or whatever. And I'm gonna try to stick with that, folks, as we talk with Dr. Long. If you don't mind, we'll just kind of go down the questionnaire we had
Just
developed with you. Who's at risk for prostate blockage? I know I am.
Well, beginning about age 40, the prostate begins to enlarge. And as a child, before you go through puberty, you really can't even find the prostate. I mean, it's there, but it hasn't begun to develop. So it's a gland that is under the influence of testosterone, which comes main male hormone that comes from the testicles. And the purpose of the prostate is to produce seminal fluid to make the sperm or spermatozoa from the testicles fertile. And it's unfortunate that it does become a problem with men as we age. But on the other hand, it does serve the purpose. It also has some antibacterial effects to decrease the risk of infections. But ultimately what happens as men age, the prostate begins to enlarge and usually begins about age 40. And of all the as you live 50s, 60s, and 70s, about half the men will end up needing some type of urologic help. And about half the men will notice a decrease in their ability to urinate, but not enough to the point where it makes much difference.
Right.
An example would be I saw a patient last week that was in their 40s who was beginning to have some difficulty. On the other hand, my father is a World War II veteran. He's 94. He's not having any problems. So it's not inevitable, but it's very, very common.
Right. Well, Dr. Long comes from a family that's been in medicine for a couple of generations. His dad's a pharmacist, and I think you have is it a brother that's a pharmacist? And,
Brother, a niece, and a nephew.
wow. But the whole family used it. Well, what causes the blockage of the prostate?
We don't really know all the causes. We know that a lot of times there'll be a family history, so there's probably a genetic influence. We know that the two most common things are kind of obvious. It's aging and it's testosterone. If you were to lower the male hormone level, the prostate does not enlarge.
Right.
So it's directly under the influence of the hormones. But as far as we know, it's not dietary. We don't think it's environmental. So there's probably a genetic component, but it's mostly the fact that it's a organ that's under the control of testosterone, and after it's stimulated, you'll get this benign growth that surrounds the urethra. So when you're younger, the channel would be open like this, and then with aging, you begin to see this closure, and finally, the two lateral lobes of the prostate come together. Prostate's about the size of a walnut.
Right.
And you may talk to your physician, he may talk about the size, and sometimes we'll quantitate it in terms of 30 cc's. So about an average size prostate is about an ounce with a kind of an opening through the center.
Right.
And then when the two lateral lobes come together, you continue to void, but you have to begin to use increasing pressure
Right.
generated from the bladder.
What are the common symptoms? I mean, that somebody needs to look out for.
Well,
Dr. Long.
The symptoms start off basically with blockage type symptoms. So you would anticipate a weak stream's getting weaker. Next thing you would probably notice is it takes longer to start urination. So when you start trying to urinate, you have to wait. And then you may notice as you stop and you start, and you stop and you start, and then at the end there's dribbling.
Right.
And those are the first symptoms. But then as it progresses, the next thing that happens is that your bladder begins to react. So the bladder can get smaller and thicker, so it can push harder. So you begin to see a decreased volume. You will then go more frequently. When you have to go, you have to go.
Right.
And sometimes you start getting up more at night.
Right.
And although a lot of people make the assumption that getting up at night is always related to the urinary tract, 50% of the time that it is, and 50% of the time it's related to other issues. But a real common symptom is getting up 3-4 times at night. What's normal, and this is kind of nice to know, what's normal is going to the bathroom about 6 times a day, and that's based on how much fluid you take in and humidity and things like that. But what's normal at night for a man 50 and under is he doesn't get up at night. And then from 50 to about 60, 50 to 70 about once, and then from 70 on once or twice. But more than that really becomes disruptive to sleep patterns.
Right.
And interestingly, you go through sleep patterns, which are about 90-minute patterns. So you start off in light sleep, go down to deep sleep, light sleep, to deep sleep. And these patterns are about 90 minutes. And I see a lot of patients who get up every 90 minutes. When they're in light sleep, they're aware of their bladder. So it can be related to the prostate and the bladder, but it also can be related to sleep disturbance and other causes.
Well, are there complications from the blockage?
Well, yes, there are. And the first complication is basically that it impacts on your lifestyle. An example would be as you're going on a trip and you know where every interstate bathroom is. Or when you walk in Walmart, the first thing you do is locate the bathroom. And
That's not normal.
here's my card. But so the first thing is it begins to impact on your
I
lifestyle.
think I do need your card though.
Pilots, they begin to get concerned when they have a trip more than an hour, 2 hours.
Yeah.
But then there are some fairly serious complications. And when you come in and you talk to your physician and he'll say, do you have symptoms? And you say, well, yes, I do. And then he'll ask you, does this really bother you? Are you living with it? And you'll say, well, I'm doing okay. Well, that's debatable whether you do anything or not.
Right.
But then you can have true complications. And the complications, there's not really any wiggle room. Bleeding. One of the causes you'll get enlargement as the prostate enlarges, and you'll get veins stretched over the surface, and sometimes they will bleed. So you'll have bleeding. Another complication would be forming stones in the bladder. So you can actually form bladder stones. We know that's a result of not emptying completely and the crystals crystallizing in the base. Another problem is not being able to void at all. You just stop.
Very painful.
As the bladder gets bigger and bigger, it's quite painful.
Yeah.
You can certainly see leakage. If the bladder is completely full, it can leak out. But the worst complication is when the pressure in the bladder is transmitted to the kidneys, and you end up having kidney failure. And
That's bad stuff there.
few people end up getting stretched out, damaged bladders, and they become to the point where they cannot void at all, even if we alleviate the blockage. Normally, alleviating the blockage takes care of all these problems.
I would think so. Yeah, this kind of makes a lot of sense.
Yeah, it's the renal failure and it's the damaged bladder that I hate to see. I saw a patient yesterday that kind of interestingly had one kidney was blocked, and where the kidney tube comes down into the bladder, the muscle of the bladder had gotten so thick that it crimped off the tube.
Right.
So I'm hopeful that when we alleviate his obstruction, that not only will he begin to void better, hopefully he will not require anything additional for the kidney.
That'd be wonderful.
Hopefully it'll start draining.
Yeah, that'd be wonderful.
Can I show you a chart? I think the chart might be helpful.
Sure. If you've got one, I don't know they'll be able to see, on their screens at home, but very rarely do we have guests that come this well prepared, and it's so nice to have a guest like that.
Hopefully, folks at home be able to see this, but this is the tip of the urethra here, this red tube. This orange area is the prostate, and this would be the bladder here. And when urologist or your physician checks the prostate, a lot of times he'll feel the prostate, and you can feel about 90% of the prostate by doing a rectal exam. So that's kind of what a normal prostate looks like. This is an example, again, same thing, different anatomy, but this is the urethra, this is the control valve here, this is the prostate, and then this would be the bladder, and this is a muscle. And then when you develop this BPH, or benign growth, then you see this condition here, where you get this white growth and it squeezes on the channel.
Right.
And when it squeezes on the channel, then the bladder will begin to change.
Wow, that's pretty impressive. Are there any exercise or something somebody can do to avoid that, or dietary things, or?
Exercises, no. You bring up an issue, you talk about dietary, we're unaware that any dietary issues impact on the prostate.
Okay.
And I'd like to make a few comments about basically over-the-counter medications.
Right.
Right now, there are no over-the-counter medicines, despite all the TV talk shows and the info commercials. None of this has ever been shown to clinically work in many of the retrospective and prospective studies. So the saw palmettos, the ginkgo biloba, the African pygeum just really doesn't work. If it has an effect, it's usually placebo.
Right.
But as far as dietary, nothing dietary. Exercises don't help. I would avoid over-the-counter, what they call phytopharmaceuticals.
Right.
The one thing that everyone that should avoid is decongestants. Decongestants are vasoconstrictors, and that's why when you have a stuffy nose and you take a decongestant, it opens it up. It causes blood vessels to constrict. It also causes the bladder neck to constrict. So in this area, one thing I see fairly commonly, about once or twice a year, a patient comes in and he has all kinds of problems, and I look through his medicines and I'll see that he's taking a medicine such as Zyrtec D or Claritin D. And the D always stands for decongestant, and all I have to do is get them off that medication, and that can also help their ability to urinate.
Well, I never would have thought that.
Another issue with the decongestants is that's also one of the common causes of erectile dysfunction, because again, it causes vasoconstriction. So, you know, for those two issues
What
alone,
if you're taking nitrates?
nitrates and decongestants?
Well, or just nitrates. It's my understanding something like nitroglycerin, or there's a medication I'm on called Metoprolol.
Metoprolol.
Yeah, that has a tendency to, as I understand it, to cause some constriction of the arteries and that kind of stuff.
The Metoprolol is what's called a beta blocker.
Right.
And it basically is seen to be cardioprotective, but it does not cause vasoconstriction.
Okay.
Nitroglycerin basically is a dilator of both arteries and veins.
Veins, right.
And the most common issue with regard to nitroglycerin in urologists is, can you take Viagra? Because if you're taking any of the, in this category of medicines is called PDE5 inhibitors.
Right.
So that would be Viagra, Levitra, Cialis, Stendra, or Staxin. There's 5 of these PDE5 inhibitors, and I would strongly advise you not to take any of those medicines if you're taking nitroglycerin or one of the long-acting nitrates, because it can interact, drop your blood pressure.
Right.
When the medicine first came out, Viagra first came out, I closed my office down except for patients who had erectile dysfunction who wanted to try the new medicine Viagra. So over the course of about 2 weeks, we had about 100 people come in, and we gave everyone a test dose in the office. I wanted to learn if it was safe, if it worked. We monitored their blood
Right.
pressure. We did some visual checks and so forth. Found out it overall was the category was pretty safe. One patient was on a long-acting nitroglycerin that didn't come up in the history that we obtained, and as it turns out, we dropped his blood pressure to about 80, And we kept him in the office about 4 hours with his legs elevated until the medicine effect wore off. So, you know, I would say there are other options.
You know, what are the medical and surgical,
For prostate blockage?
we've only got about a minute left.
Okay.
So,
For prostate blockage, you can do medical, which is different medications you
Right.
can try. They're relaxants. When they don't work or you don't want to take them, then the most common option is to do some type of surgical procedure with a scope.
Right.
My preferred option is what's called the green light laser.
Right.
It, for me, has generally replaced the old-fashioned Roto-Rooter or TURP, which is still the gold standard. But the green light laser, I think there's an old expression about picture is worth 1,000 words. The green light laser is done as an outpatient, and this picture alone would kind of explain. This patient has a blocking prostate here.
Right, you can see it.
He's voiding through this slit right through here. This area down here is a small hole in the wall of the bladder called a diverticulum that he has developed because of the pressure in his bladder. But when the green light laser is finished, this is the new channel.
Right.
So this was before and this is after. Normally takes about an hour, and it's usually done as an outpatient. And the improvement in voiding, at least in my patient population, is about 96%.
Will you be able to do those procedures here in Andalusia?
You can do this in Andalusia. You can do it you can do it in outpatient centers. You do
Right.
require anesthesia, and it does require a catheter for about a week while the healing begins.
Mm-hmm.
But the improvement in the stream is almost immediate.
Right.
It takes about 6 weeks for some of the irritative symptoms to improve.
Well, Dr. Long, we appreciate you being on here today.
Thank you. It's been a pleasure.
We've had so much information. Can you come back on here and maybe where we can have another interview?
Absolutely.
And for and maybe even going more into depth. You know, I know we've talked mostly about men's health issues here, but
Yes,
there are women's health issues as well. That
There are.
that you get into, and I would love for us to look forward to doing that.
I appreciate the invitation.
Good
Glad
deal.
to do
It's
it.
wide open, Dr. Long.
Thank you so much.
My
Thank you all.
favorite story about not Dr. Long, but the urology, and it occurred when I was a young man, and I was going through the Atlanta airport, and I had to stop and go to the restroom. And at that time, the Atlanta airport had, rather than having urinals, had troughs that you could urinate in. And while I was there, they announced a PA announcement looking for where John Wayne was. And everybody was standing at the trough, turning around, and the guy next to him to see it was John Wayne. And about half of them peed on each other. So, anyway, folks, thanks for watching us. We'll see you soon.